I was DQ'd for asthma because I was prescribed an inhaler after age 13. What should I do? And this is a very common one. Very common. Unfortunately, young people are prescribed an inhaler probably too often, but the doctor is being conservative, as they should. They're looking out for your best interest. But unfortunately, the way the DODI 6130 is written, it is disqualifying. The DODMERB Bible disqualifies you for any inhaler after age 13. Okay, so that's the reality we live in. Even though the doctor was being conservative, they obviously didn't know, and you didn't know that you probably were going to pursue the military later. So because of this, what do you do? And the answer is there are two tests that can help you fight for a waiver granted. The first one, and it's more easy to schedule and less intrusive, is what's called a PFT, a pulmonary function test. It can be given at your local pediatrician's office. There's several ways to do it. It's usually through spirometry, and you're breathing into a tube and they're measuring your lung capacity. Do not go to this PFT if you have a cold. Schedule it when you are not sick, when you have no upper respiratory symptoms. Do the PFT if you can pass the PFT. If your PFT can be within normal limits, that is one piece of diagnostic evidence that could be in your favor when they're reviewing whether to give you a waiver for an inhaler or asthma. And that's the easiest way. The second and most thorough way is to do what's called a methacholine challenge test, an MCT. A methacholine challenge test is usually given by a pulmonologist. It might not be covered by insurance. So it might be more expensive. You might have to wait a longer time to get an appointment. But this is the gold standard for seeing if your airways are hyper-responsive or not. If you were to pass the MCT, that would be additional medical evidence that could go in your favor, that could fight for you to possibly get a waiver for asthma. So there's two tests for that, MCT and the PFT.